Hey everybody, we are back with a movement performance update. Today we're going to look at an ankle, a lower leg and ankle sequence. This spring, as with every spring, there have been a lot of ankle injuries, whether it's been hiking or lacrosse or pickleball or golf or ballet. We've just been seeing a lot of ankle injuries as we seem to every spring and into the early summer. And so once we get the pain down significantly and once we can begin to load that ankle, begin to get some motor control and some mobility back, this is how we supplement the work that has already been done after the majority of the pain has been taken care of. So what you'll see here is just sitting in a chair, we're going to let that knee and that hip go back and forth freely. We're focused on inversion and eversion of the foot. We're working on the lateral and medial sides of the lower leg, those muscles that control ankle inversion and eversion. And you can see when I go into eversion, when I raise the lateral border of that foot and ankle, I work really hard to plant that big toe. So do about 15 or 20 of those, and then we'll go ahead and move on to the next step. Now let's move on to the second portion of this sequence. So you can see that now I'm working really hard to keep that entire foot planted. And in particular, I'm working hard to keep the big toe down and engaged with the floor. I go ahead and use my hand to kind of guide the knee back and forth across. So lots of movement at the hip, but we want a lot of stability coming through that ankle. So we're kind of gripping onto the floor with that ankle. We're getting our inversion and eversion kind of in a sense in reverse through this exercise. So before we let the entire hip and knee complex go, we let that lateral and medial border of the foot come back and forth up off of the floor. Now we're going to keep that foot planted and we're going to kind of fine tune that control around the ankle foot complex. After about 15 or 20 of these, we will move on to the next phase. And for the last portion of this motor control sequence for the ankle foot complex, now we're going to hold the knee in place as much as possible. Keep that knee from deviating either medially or laterally. We're going to go into eversion and inversion. So there's inversion, eversion. Again, focus on just raising the lateral border and the medial border of the foot. When I go into eversion here, I work as hard as I can to keep that big toe down. You can see I'm fighting pretty hard. Even when I try, that big toe wants to come up. You'll probably find that is similar with you as well. So we have three exercises within this sequence that is going to help you mobilize and loosen up that ankle complex, that foot ankle complex, as you begin to recover. This is just a really good mobility exercise, even if you're not injured. But if you are injured and you have begun to recover and we have the pain down significantly and you want to begin to get that neuromuscular control back, this is a great way to re-engage that entire lower leg, that entire ankle foot complex in a sequence of 3 different exercises that activate the muscles in just a little bit of a different manner with each movement. So it's spring. Take care of those ankles. Thanks so much for watching. Please send me your questions, and I look forward to seeing you again soon.